Hi, you're welcome to my channel. I'm Dr. Abisola Deborah. In this video, I'm going to be talking about vaginal yeast infection, the causes, what is present with, the treatment, and the preventions. If this is a video you'd like to watch, let's get right into it. So what are the causes of vaginal yeast infection? What are the predisposing factors? One is diabetes mellitus. Another is HIV infection, generally immunosuppression. So, or maybe if you're under immunosuppressive therapy, you could have vaginal yeast infection. Okay. Another is vaginal discharge. If you are the type that washes your vagina with soap or liquid solutions, you could be predisposed to having vaginal yeast infection. Another is wearing of tight fitted pants or nylon pants. What you are doing is you are making the place more conducive for the infection to grow. Okay. And also if you are under high estrogen therapy, or maybe you have high estrogen, like in case of pregnancy, you could have vaginal yeast infection. Okay. So what are the clinical features? What are the things that you could present with if you have vaginal yeast infection? You will notice that there is intense itching under there. That baby girl down there is itching seriously, which is out of proportion. Okay, you just want to itch, you just want to go somewhere, go to one corner and just itch down there. It's a sign of vaginal yeast infection. Okay, redness of the vagina and vulva is a sign of vaginal yeast infection. Okay, and if you notice that you have thick flakes, cottage cheese kind of vaginal discharge, whitish vaginal discharge, which is thick, which looks like cottage cheese, is also a sign of having vaginal yeast infection. Okay, so how do you treat vaginal yeast infection? You treat topically with imidazoles. Okay, but in case of severe infections, you might have to take oral fluconazole, ketoconazole for like 6 or 3 months, depending on what your doctor tells you. Okay, so if you notice that you've been having it and having it and having it, you might need to consult your doctor. Okay, and in pregnancy, you don't use the oral drugs. You consult your doctor if that is going to be done. Okay, you treat it topically, vaginal pessaries and all of that. Okay, so what is the prevention? What are the preventions of vaginal yeast infection? I want you to know that you shouldn't be douching. You shouldn't be washing your vagina with soap. You shouldn't be washing your vagina with liquid solution. Let it rest. Let the baby girl down there rest. Okay, don't do that. You shouldn't be wearing nylon pants or tight fitted pants. No, it's not okay for you. You are making that environment conducive for the thing to grow. You shouldn't do that. Okay, another thing I forgot to mention about the what vaginal yeast infection presents with is there could be pain during sex. There's soreness down there. There could be pain during sex. You don't just enjoy the sex, it's just dry down there, it's just painful down there. It's another sign of vaginal yeast infection. So back to the prevention. You shouldn't douche, you shouldn't wear tight fitted pants, and if there's any underlying disease, try and treat it. If there's anything that is making your immune system suppressed, try and treat it. Okay, thank you for watching. God bless you. See you in my next video. Bye bye.
Open eye, feel the waves cut through me.